Hello everyone and welcome to Module 5. This week we are in what we call midterm week, so that's pretty exciting. You've now made it halfway through your quarter. We are focusing this week on assisting with the physical examination and chart documentation. So let's go ahead and start and look at the two chapters that we have for this week, which are Chapter 11 and Chapter 36. So Chapter 11 is focusing on written communication. Medical assistants draft many different types of correspondences to be signed by the physician or the employer. These letters must reflect the professionalism of the medical practice, and every piece of correspondence represents the medical office, and the impression of the office can be formed based on such correspondences. So what that means is when you're writing or when you're drafting a correspondence, there are a couple of things that you really need to pay attention to. First is the tone of the letter. Letters from a medical office must be professional, courteous, businesslike, positive in tone, and protective of the confidentiality of the physician and the patient. Try to avoid using any threats or derogatory comments. These are never acceptable in any professional correspondence and may have legal consequences for the sender. The other thing you need to pay attention to is using grammar and word choices. Correct grammar and appropriate word choices in correspondences reflect positively on the overall quality of the medical office. Appropriate word choices include avoiding any technical terms, gender biases, which are inappropriately indicating whether male or female in the language used, overly long sentences and paragraphs, any excessive use of the personal pronunciation I, incorrectly using abbreviations, and using a passive voice. You always want to use what we call as an active voice. Alright, so once you've started to know what you need to watch for writing a correspondence, we now need to format that correspondence. So composing letters can be simple when you use an organized approach. Before you begin the letter, think about the points that you're trying to make. And if it is a long letter, you may want to jot a bullet point list to ensure that you don't overlook any important information. Business correspondences can use a variety of formats and styles, but most letters will include the same standard components, which are a heading, the date, inside address, salutation, body, closing, reference initial, enclosure notation, and a copy notation. The heading is typically for medical offices, will include things such as the physician or the practice, the address, telephone number, and fax number if there is one. With the date, every correspondence must have a correct and current date. The inside address contains the name, title, company name, if applicable, and the address of the recipient of the correspondence. The salutation is a courteous greeting that is typed to the left margin and placed 2 lines below the inside address. The name in the salutation must agree and comply with the name that is on the inside address. Your body is the main text of the letter, which conveys the purpose of the letter. Your closing will consist of a complimentary close containing courteous words such as sincerely, sincerely yours, or yours truly. A reference initial is the medical professional's use to indicate who keyed or typed the letter. The enclosure notation is what we use when other documents are included along with the letter. And a copy notation is a type of correspondence kept for the office records, and the copy of the letter may be sent to someone other than the addressee. Then what we have to figure out is mailing. Now, there are classes of mail that are designated by the USPS, or the United States Postal Service, according to weight, type, and destination. Mail is always weighed in ounces and pounds. The most common types are first class, priority, periodicals, standard mail, package servicing or standard post, and express mail. First class mail are letters, postcards, business reply cards, all weighing less than 13 ounces. Priority mail is first class mail weighing more than 13 ounces, but up to a maximum of 70 pounds. Periodicals are newspapers that have received second-class mail authorization and are not allowed for newspaper or periodicals that are mailed by the general public. Standard mail is advertisements, circulars, newsletters, small parcels, and merchandise. Package services or standard post are merchandise, catalogs, printed material, and computer media. And Priority Express mail is available 7 days a week, and it weighs from 70 pounds up to any amount past 70. Then it also is a maximum of 108 inches around. All right, guys, so that is Chapter 11 kind of in a nutshell for you. Let's move on and talk about Chapter 36, which is actually the bigger chapter for this week, talking about the physical examination and how you assist with that. Now, assisting with physical examinations is one of the key responsibilities of the medical assistant. Your role during this will include preparing the exam room, interviewing the patient, documenting all the information in the medical record, positioning and draping your patient, assisting during the physical exam, cleaning the room after the visit, and taking care of any instruments. So let's go ahead and take a closer look at what this means for some categories. First, we have preparing the exam room. This will require the medical assistant to dispose of the used patient gowns and drapes, clean the exam table with the proper disinfectant and replacing the table paper, disposing of any equipment used during a previous exam. If it is reusable, however, you need to make sure the equipment is clean and disinfected properly. All surfaces in the exam room must be disinfected and with the appropriate cleaner. And you want to close all the lids on any biohazard containers, and if it is full, remove it and replace it. Next, we have your patient interviews. This is completed when we take a patient's health history, and that's typically broken down into 6 categories. We have your chief complaint, present illness, past medical history, family medical history, social history, and review of systems. The chief complaint is the reason for the patient's visit that day. It's also called just a CC. Present illness contains the detailed description of the symptoms, such as the onset, the duration, and the intensity of each symptom. Your past medical history is the part of the history that includes all diseases, medical problems, and that the patient has experienced in the past. Your family medical history is the record of the medical problems of the patient's blood relatives. For example, mothers, fathers, brothers, sisters, maternal grandpa and grandma, maternal or paternal grandma and grandpa, aunts, uncles, all related by birth. Your social history includes your lifestyle patterns that could affect your health status, such as smoking, drinking, recreational drugs, occupation, marital status, sexual preference, diet, exercise, and sleep habits. And last, we have the review of systems. This is typically performed by the physician. The physician will use different methods to examine and inspect the patient. There are 6 methods typically used. Those are inspection, palpation, percussion, actualization, mensuration, and manipulation. I will leave those for you to read on. Those are in chapter 36 for you. Next, we have positioning and draping the patient. It's important that we keep the patient's dignity and pride in mind when we're draping them to be seen for the physical examination. Draping the patient is done by using a sheet to keep the patient warm, but also keep them covered except for the body part that is being examined. Positioning the patient helps the physician with the examination. And there are 11 positions that you will be responsible for knowing. Those are supine, dorsal recumbent, lithotomy, Fowler's, semi-Fowler's, prone, Sims, knee chest, Trendelenburg, proctologic, and sitting. So please make sure you review those in your book, as well as the descriptions of each of those. The last thing I want to talk about is actually physically assisting with the physical exam. As a medical assistant, you will help the physician by positioning and draping the patient for the exam. Note, if they are elderly or disabled, you may have to help the patient maintain that correct position. You will be responsible for handing instruments, equipment, and other medical supplies to the physician, document and label all specimens, offer reassurance and comfort to your patient. Some of these exams are not the easiest for them, and it will make them feel very uncomfortable. You will also act as a witness to the behavior of the physician and the patient. If you have a male physician and you as the medical assistant may need to be present during female breast and pelvic examinations. You're going to help carry out any treatment plans, which may be providing education, applying dressings, or administering any medication or immunizations. You will be responsible for scheduling diagnostic tests that are ordered by the physician. And really, during this, you are going to be the second set of hands and eyes for the physician. All right, guys, that is all I have for our review this week. Please make sure that you notice that first thing for your assignment this week, there is no discussion board. So we took that off the table for this week. But on the flip side, you do have 2 written assignments. Your first written assignment is over the course project, which is dealing with TB testing, so tuberculosis testing. You'll want to review that VIS summary. Again, make sure that you're checking the rubric that is placed on Module 5, so that way you can answer the appropriate questions that are needed. You will have a written assignment, and it is a worksheet that you will pull up in Blackboard, and you can fill in your answers on that worksheet and then submit it for grading. The worksheet is based off of positioning your patient for physical exams. So you will need to use your book as well as what I gave you here in the video in order to help you with your written assignment this week. The last thing that you do have is your Module 5 midterm exam. This exam is going to be made up of multiple choice and true-false questions. Your midterm exam is 25 questions long, so make sure that you are prepared for that. And it can go over and will go over anything that you have learned or looked at or taken a quiz on up to this point. Now, all 3 of these assignments will be due no later than Sunday, May 7th by midnight. As always, if you have any questions, comments, or concerns, please make sure that you are reaching out to me right away, either via course messaging or you can reach me by phone at my direct line on campus, which you can find on your course homepage right by my picture in the instructor information. I hope you all have an awesome midterm week, and way to make it halfway through, guys. Keep pushing through now that we're halfway there. Bye, everybody.